Welcome back to another week of Sippy Cup Shenanigans. I'm Taylor Palmer.
And I'm Katherine Jensen, and this week we are going to be talking pregnancy, which is a very broad topic. There's a lot of things we could touch on, but we're going to try to focus on a few questions that seemed most relevant to us, hopefully relevant to you guys, and we'll see. We'll see.
Where where the wind blows, where it takes
Yeah.
us.
So to start, let's talk about everyone's favorite part of pregnancy, which is the symptoms,
Mm,
which are just so lovely. So what are some of the symptoms you experienced that you felt like were like affected your daily life the most?
that's a good question. I think first and foremost at the front of my entire
Mhm.
pregnancy was morning sickness, which I didn't know was not just morning sickness. It was all day,
Yep.
24/7 sickness
Yeah.
that never went away.
I said that so many times throughout my pregnancy. Like, why are we still calling this morning sickness?
It's
It's
just sickness.
it's just pregnancy sickness. It's
Yes.
just like nausea 24/7.
Yeah. And I feel like it wasn't like you'd think if it was morning sickness, even if it was all day, that it would be worse in the morning. Mine
Mhm.
was worse at night. Like the
Same.
nights were terrible.
Same.
And that was when it was like hard to go to sleep because I would almost just be in fear that I was going to get sick. It was like, is tonight the night? I'd be like
You're like
deep.
anticipating it.
Yeah. But it was like just like deep breathing in bed. I would sit in bed with I'd get cutie oranges.
Mhm.
Um, when I say it was actually my wonderful husband who would go and get them when I was crying and telling him I needed something.
Yeah.
I was like, I need another orange. And I
Yeah.
would just sit there and like sometimes I would eat them, but usually I just like smell them.
Smell them.
Mm-hmm.
Mhm.
Because that was the only thing that would help. Um, until I was told that I could take B6 and Unisom, which did help to a point. It didn't like cure me. I was still doing the sniffing of the oranges with the
Yeah.
B6 and Unisom. I never had
Yeah.
anything that was like, "You're all good, your symptoms are gone." But yeah, that was the absolute worst one for me.
I agree.
Yeah.
I agree. And I did the Unisom and B6 as well, which like I almost moved to like a prescription one.
Mm,
I was like on the edge. I'm like, it's doing just enough to like take the edge off,
hmm.
but I kind of wish it would have helped more, but
Yeah. Did
yeah.
you have the same? I feel like that was my worst with my first pregnancy, but the second pregnancy I did have other things like back pain.
Oh, yeah, back pain was for sure worse with the second one. I think part of that too is like you're picking up and chasing around a toddler. So
That's
that
true.
probably contributes
Yeah.
to some more back pain.
Yeah.
But I definitely had more back pain with the second one. I didn't wear it as much as I should have, but I did have like one of those belly bands, like
Yeah.
support bands, and it helped some when I would remember to wear it, but
I got one too. And I think I wore it I wore it to the zoo once. And
mm,
it helped,
yeah,
but I would always
yeah,
forget to wear it.
same, same. I'm like this would be helping me more if
Yeah.
I was consistent with it, but I
Yeah.
wasn't.
Mine was like bad to the point of like was crying at home and then basically towards the end of my pregnancy basically begging my doctor to let me be induced early
Yeah.
because
Oh,
I
because
was
you're in
so
so
done.
much
It was the
pain.
back and then my rib, but that was
Oh,
because
yeah.
he had like fully lodged himself. Like his foot like you could see was lodged in there. So I guess that's not a symptom, but it was something that happened with pregnancy.
Totally. No, I would say that is like a symptom, like being uncomfortable and like the pain that comes with
Worst.
it. Yeah, it's so hard, especially at the end. It's just like
Get them
you're
out.
just so uncomfortable. And I actually didn't really experience that as much with my first. I did have
Mhm.
him earlier. I was at 37 weeks. So that probably helped. But like with Hayes, I almost went to my due date, and like I just was so uncomfortable. Like I
Mhm.
couldn't sleep. I don't know if you experienced insomnia at all.
It
Oh my
wasn't that I
gosh.
couldn't sleep, but it was just hard to find a position to sleep in.
Yeah, yeah. I would wake up like the probably the last month of my pregnancy, I would wake up at like 3 or 4 in the morning every night and not be able to go back to sleep. Yeah.
No.
Yeah. So I was like, well, if I'm not sleeping, I might as well have the baby and like deal with the newborn sleep because I'm not sleeping anyways.
Yeah. Nope, I didn't have that.
Yeah. It's so interesting too how like well, I think there's a lot of symptoms that are like fairly common across the board, but there
Mhm.
are also things that can be very different from person to
Mhm.
person.
I did have like this goes along with the nausea, I feel like, but food aversions. That
Uh-huh.
was a big thing.
Yeah. I had very intense food
Mhm.
aversions. Pretty much all food was like
Yeah. And did it would make me like and then the hormones are going crazy, so I'd be like crying because I was
Yes.
so upset about it and
Yes.
like hiding upstairs like I can't like my husband would be making something and I can't. I don't want to smell it, but I'm so
Yeah.
hungry.
No, it's so true. I especially my second pregnancy, like the nausea and the sickness like affected my mental health like
Mhm.
so much because I just was feeling so lousy. And so yeah, I do remember just like sitting and crying being like I just want to feel better. I just want to like I want to enjoy food again.
Just tired,
Mhm.
sleepiness. I was
Mm.
always sleepy. Now I'm like
Oh
remembering
yeah.
like those beginning. I was always
Yeah.
tired.
So tired.
Did you ever get this is a weird one that I had. Like toothaches?
I did not have that. No,
When I
not that I
first
remember.
like before I found out I was pregnant, there was one night where my like one of my teeth was hurting, but it was moving. So it was like it would hurt here, but then all of a sudden it'd kind of like go away and then like hurt somewhere else. And I was like, okay, so this obviously isn't like my tooth because the pain is
Yeah.
moving. And I
Moving.
remember laying in
Mhm.
bed going, I think I'm pregnant because
Oh,
this isn't normal.
seriously?
I'm not even kidding.
Oh my gosh. It's like something super strange is happening to my body. I
Yeah.
must be pregnant.
Yeah. Well, I'm like, I like got my phone out too. I was like, is this a pregnancy symptom? And it was. I was like,
Seriously.
yeah. I was like, okay, I think I'm
See,
pregnant.
I feel like things like that come up with like different people, just random
Hmm.
symptoms. And it's like, yeah, that's actually because you're pregnant.
Yeah.
And it's like, it just does the most crazy things to your
Yeah.
body.
Yeah. And I think Dwayne came to bed that night and I think I told him, I was like, I think I'm pregnant. I have weird things happening. He was like, and then I was. How can you distinguish those normal discomforts from like different complications and managing like anxiety surrounding those?
That's a great question because that's definitely something that I dealt with both my pregnancies, like every little thing. Well, less the second time around because I knew a little bit more what to expect, but still there was like that underlying fear and anxiety of like, is this normal? Is
Hmm.
this a normal pain? Is this like a normal feeling? Or is it like, does it go beyond that? I think it can be really hard actually to distinguish. I where I was seeing my doctor, I could like message them through an
Hmm.
app. So I was like constantly messaging my doctor, like, hey, I'm experiencing this. Like, does that sound normal? And, they would most of the time reassure me. I don't know. It's like, it is a constant kind of anxiety
Hmm.
of like, is this normal? Is something going wrong? And I experienced that also towards the end of my pregnancy. Well, maybe like the second half of my
Hmm.
pregnancy, I got really bad Braxton Hicks. Like
Mm.
I had Braxton Hicks, yeah, like my whole pregnancy basically, but they would
Really?
get pretty intense sometimes. Like
Hmm.
the last half of my pregnancy. So I was always like, is this like,
Yeah.
is this more than just a Braxton Hick? And like, I would time it and, like, so I was always constantly like on edge
Yeah.
because I was like, oh, wait, is this like a normal like cramp or Braxton Hick? Is this like preterm labor? Like,
Yeah. But that's great that you had an app that you could use
yeah,
because
it was
I
helpful.
didn't have that. I did have a number, but it was like for
Mm,
emergencies. And so it
mm,
was like, and then if I
yeah.
had questions, I'd have to call the office and they were only open twice a week and they would get back to you,
Oh,
but they didn't get back to me that quickly. I would have used that app a lot.
yeah.
Otherwise I feel like it's bad because you're just on like Google and
Which is not a reliable
no.
source.
Which is
Yeah.
what Dwayne would always tell me when I came and
Yeah.
told him, like, so he's like, Taylor, where are you looking at? Like
Yeah.
the top answer on Google, whatever that is, like you can't do that. I'm like,
Totally.
well, it either is like really good or really bad. I don't know. It's
Yeah.
somewhere, I don't know if there's an in between there.
Yeah.
Like, I
I
always
either
did
need
that.
to go to the emergency room right now
Yeah.
or I'm perfectly fine.
Yeah.
So, which
Yeah.
one is it?
Because you just don't know. And I feel like when you're pregnant, it's like I just always wanted to be on the safe side because I'm like, I don't want to not do
Yeah,
anything and have something be like totally wrong.
totally. Yeah.
Um,
And I think that's like when in doubt, like you should go
go
in.
in. That's what
At
I
least,
would tell people.
yeah, at least, give yourself some peace of mind
And I
and
think what's hard about that, and this might is not the case for everyone, but I think it kind of depends on who you see when you go in
mm,
because you could go into the hospital and say like I'm having this and this. I'm hoping nothing, but I just
yeah,
wanted to be safe. And they
yeah,
could give you like the side eye and look at you like you're crazy. What are you doing? Or you could
right.
get somebody who's really great and is like, "No, feelings are valid and it's always better to come in."
Yeah,
So, I feel like that's also an issue too because it's like if you go in and you get that side eye person, it's like that doesn't make me feel confident in coming back in. But when you go in and you get the person who's like, no, you're valid, this is the smart thing to do, it's like, okay, I'm not crazy. I'm just being, protective of my body and the baby that, is growing in me. So
yeah. That's a really good point.
if you do go in and it's nothing and then something happens again, right? They make it
Yeah.
feel like, well, I don't want to go in because last time they thought that I was crazy when something could
Yes.
really be happening that next time.
Totally, totally. That does make a big difference. How would you say pregnancy affected your body image? Like how you viewed yourself?
I don't think it affected too much the first pregnancy. And I think the first pregnancy I didn't gain too much. That's just me. That was my body type. That I was grateful. And my body kind of just bounced back for the most part. So I was kind of like pleasantly surprised and okay with it. During pregnancy, I think I was just like more excited. I think body image wise, like growing the bump, I was a little bit, I don't know if I'm like in a small population of women feeling this or not, but I was like, I just gotta say I'm pregnant. So right now I'm super bloated, but I'm like, oh, I'm
Yeah.
pregnant. I didn't
Yeah.
care. I was like, I'm pregnant. It's great.
Yeah.
Um, but after my second, it's been a lot harder to bounce back. And I gained more the second go around and then it's not falling off like it did the first time. And with two, it's harder to find the time to
Mhm.
exercise and do things that are going to help my body and even just eating right because I'm like just eating random snacks that I can
I
find
know.
and
Yeah, it's hard.
it's rough. I mean, with Riley's new uh milk protein allergy, it has made me start eating a bit healthier, so that's good.
Mm,
But no, the second go around's a bit harder, and I've been struggling a bit, not really fitting into most of the things that are in my closet, and that's hard. It makes me feel less like myself or who I had
yeah.
been before, which is
Yeah.
rough. But I'm trying to give myself some grace and tell myself that I carried a whole human inside of me. My
Yeah.
body created life and I need to find clothes that fit me for right now, not
Mhm.
to force my body to fit the clothes I had before. So,
Yeah, that's a great way to look at it. Find clothes that fit your body, not the other way around.
yeah. What
Because
about
your
you?
body changes. Like, you can't expect
Mhm.
your body to stay the same or go back to exactly the way it was.
Yeah.
I
What about you?
agree. I definitely struggled, especially with my second pregnancy. Like, not only because I was just like feeling crummy, but I didn't have that excitement like I did the first time of like, oh, my bump is starting to show.
Mhm.
I was like, "Oh my gosh, like my bump's already showing," like, and like I look huge, like I'm only, 15 weeks or whatever, and I look, and I that's how I felt. Like, I don't know,
Mhm.
and I was more like resistant to the changes
Mm.
the second time. I don't know, I'm not sure why. I just didn't feel like myself. I would look at myself in pictures and just be like, no, I don't, that's not me. Like,
Yeah.
it
I
it
did
didn't
that
look.
too.
I was obviously so grateful to be carrying my baby and like that he was growing and all of those things, but at the same time I was just, I don't know, I was like not embracing
Yeah.
the change, whatever the opposite of that is.
Yeah.
That was me, and I didn't feel good about myself. It was
Yeah.
hard.
Yeah. That is hard. The whole looking at, you said looking at pictures of yourself. I can relate
Mhm.
to that completely. You get bigger faster the second go around. And
Yeah.
that is hard to accept. And
Yeah.
I don't know about you. I had family that was telling me, like, your bump is showing. And I was like 8 weeks pregnant. I was like, no, it's
Yeah.
not. Maybe I'm bloated, but
Yeah.
it might have been my bump. I mean,
Yeah.
I would get bloated a lot faster.
Yeah.
And that it's hard because you're like, okay, well, it's like you almost just get your body back and then you jump right
Yeah.
into losing it again.
Right. Totally. And I think there's like set expectations kind of around, how much you should or shouldn't gain
Mhm.
during pregnancy. And with my second pregnancy, like I gained a lot of weight. I think I was supposed to gain between like 20 and 35 pounds or something like that.
I think it's more. Please tell me it's
No,
more.
I think according to like my pre-pregnancy weight, like I think that was the recommended
Really?
amount, was like gain between 20 and 35 pounds, and I gained at least 60 pounds. Like, and I was really ashamed of that because I was like,
No.
I'm doing something wrong, like
No.
I'm not
I know.
managing this well enough. And like eventually I just had to stop looking at the scale
Yeah.
because it was making me so depressed.
Would you like weigh yourself at home?
Yeah.
Oh yeah, no, I didn't touch that.
Oh, yeah, I would, because I felt like I needed to keep track and make sure I was staying within that amount,
Oh,
and then I was just like, this is not happening. Like, I'm
yeah.
gaining weight way too fast. Luckily, my doctor reassured me that like I was just fine
Yeah.
and that I didn't need to worry about it. I still worried about it
Yeah.
and I
I
still
mean,
stressed about it. And I was like, oh, this is going to be so hard to lose. But luckily, I didn't ever feel looked down on by my doctor, which was
yeah,
really good.
that's
I think
good.
just like looking, I don't know, like looking at other people or social media, or like, yeah, just like Googling, like, what's
Mhm.
the right amount of weight, or like,
Yeah.
I'm 26 weeks pregnant, like how much weight should I have gained by now? And I was like way past,
Yeah.
like,
Social
like,
media is hard to look at when you're
yeah,
pregnant. I feel like I got to figure out how to bounce back from this.
right,
And you
right,
don't have to bounce back from it
right,
right away. Like,
totally,
that's something that I keep telling myself because I'm hard on myself this go around. I'm just like, I'll say, like, I feel like I'm fat, and that's not helpful. And it's not,
right,
and it's something that I'm watching myself because Everly is old enough to understand things now, and
right,
I don't want
right,
her to start having body issues because her mom
totally,
is saying she's fat when her mom
right,
carried a baby. So it's it's me also trying to mentally figure out how to be okay with it and just be healthy because I don't want
Yeah,
her to take on anything that I'm feeling as well.
totally. Yeah,
So
that's
that's
so
a
true.
fine line to walk as well. It's rough mentally, but also I don't want her to think that I feel bad about myself cuz she doesn't see
Yeah.
anything but mom, you know what I mean?
Right, right.
So I feel like
Yeah.
I just have to
And she thinks you're
remind
perfect.
myself. Exactly. So I have to you have to think like how your kids see you. Your kids see you
Yeah.
as perfect.
Yeah, that's so true.
So just
That's so
remind
true.
yourself that.
Yeah, think about how your kids see you, and yeah,
Exactly.
they love you just the way you
Just the way you
are.
are. Along with body changes, take
Mhm.
it a little bit more spicy, I guess. Uh couples, sex life. How does
Yikes,
that
is what I
change
have to
during
say.
pregnancy?
I have friends who get horny during pregnancy. I'm just gonna say it. And that is not me. Yeah, my body is like, nope.
The
Like,
whole
well,
time?
the whole time. Like
Really?
it's yes, like my libido goes down.
Mhm.
And I think a big part of that is like I'm not feeling good. I'm
Yeah.
not feeling good about myself, like we were talking about with like the
Mhm.
body image. Like I don't feel sexy, you know,
Nope.
like,
Mhm.
and so I think that mentally plays into it. And then yeah, like the hormones. So unfortunately, I never got to that point where I was like, let's get it on. Yeah, my
Okay.
libido just like takes a vacation. It doesn't come back for a long time after I have a baby. I'm like, okay, when are you going to show up? Like any day now.
I'm not that far off from what you're saying myself. The nausea never fully left. I was sick pretty much the whole
Yeah.
pregnancy, but it's the worst in the first trimester.
Yeah.
And during that time, other than before I felt sick, nothing. Like, I don't want you to touch me. I
Yeah.
like at all. Like, I just don't even, no, nothing. Like, I am my own person and
Yeah.
I want you nowhere near me.
Yeah.
Um, so that's rough. I will say there's like a small stint during the second trimester for me both
Mm.
times where I'm like, yes. But maybe it's like the end of the first trimester going into the beginning of the second. The problem is that I can't do it. I have to take a pill. I'm just going to say it. After I have sex, my body just will get UTIs all the
Oh,
time.
yeah.
And I had to like go to a doctor once and she was like, it's more normal than you think.
Yeah.
So I have to take something after every time. So I don't take that during the first trimester because it really freaks me out. We have to wait. So then even at that, like I won't do any, it's like maybe once a week. And so it's like you get it like a couple times and then it's like
Nope.
then I get back into that I don't want to do it again. And I'm
Yeah.
like too big. I feel like
Yeah.
I would always say I'm like a beached whale.
Uh-huh.
I can't
Yes.
move and like
Yes.
it's so uncomfortable and I would feel so stressed after having sex that like I had hurt the baby.
Yes.
And it was like this isn't fun because the whole time we're doing this all I'm
I'm,
thinking
like,
of is the
worried about
baby.
it. Yeah. Even though they tell you, like, it's totally fine, like, you're like, "Is it though?"
Yeah.
Yeah.
I'm like standing there I'm like waiting for him to kick after. I'm like, "You good? You good
Yeah.
in there?"
Yeah.
So it's like
Totally.
it's not really just an enjoyable experience.
Totally. If you're worried and, like, uncomfortable, like, who's gonna wanna do that?
No.
Yeah.
No. So yeah, and then after pregnancy, it's just no, not there yet still. And then you're
Yeah.
healing. Even
Yeah.
even at that 6 week mark, it's like
Oh,
I'm still healing.
you're still healing, your hormones are still regulating, like,
Exactly.
you
I'm
have you're sleep deprived, you're super
mhm.
tired, like, everything is against you.
Yeah. Yeah.
So,
My poor husband. I do feel
yeah.
I'm like I still love you.
I
I love you very
know.
much. And then this go around, it's like I kind of got back to a place where it was okay and then he had a vasectomy because we're done with kids. So We love our two children when we're done. But
Yes.
then after that, I'm like, there's like a healing process with that too. I'm like,
Yeah.
I don't want to touch you now. So we're gonna
Yeah.
wait longer. And I'm still not fully in a place where I'm like you. My libido's shoo. Does it ever concern you?
That it's so low.
Well, because it concerns me
Yeah.
sometimes. I'm like,
I
should I feel a certain way and I'm not? Like, is that
Well, my I brought it up with my doctor once because I was like, yeah, I'm like, this is kind of frustrating.
yeah.
And she's like, it's super normal. It's like your body's way of trying to keep you from getting pregnant too fast
Mm,
after having a baby. Like it's trying to make sure your body has that time to heal that it needs, which I thought
that's
was interesting.
interesting.
Way back when, it's not like they had birth
Yeah.
control, and it's like nature's way of trying to keep you from getting pregnant too soon.
Interesting.
Yeah, so she's like, it's totally normal. Like, and also she said nursing, that
Hmm.
also plays a role. So she's like, give
Interesting.
it time. And
Well, that makes me feel better. So
yeah, so I think it's normal. It doesn't make it less frustrating or like hard on your marriage.
it's
It's
a
hard.
season. It's a
It's a
season.
season.
It is. And
Yeah.
I think it's not, I feel grateful that I have a partner who's willing to be accepting of it and
Yeah.
understanding because I know that's not
Yeah.
everybody's case. And so I am appreciative that he is like, I understand. And, we'll
Yeah.
just, it's part of where we're at right now and it'll get better with time.
Yeah, and we've talked about this before, but I think the biggest thing there is just communication,
Exactly.
right? And just making sure you're open about where you're at and trying your best.
Trying your best. Both sides. Yeah. It can get rough.
Speaking of rough things in pregnancy,
Mm,
something you and I both experienced in
nice.
pregnancy was gestational diabetes,
Mm,
unfortunately, with our
so fun.
first. So let's touch on that a little bit.
Yeah.
With gestational diabetes, I didn't have any like symptoms beforehand. Like I didn't know until I took the test, the glucose test,
Hmm.
and failed, and then had to take the 3 hour test and
Hmm.
then failed. So it didn't affect me in that way. Like I didn't have any symptoms. Did you?
No, I've said before, I contemplate if sugar, like after I ate sugar, I would feel kind of sick.
Mm.
And I had friends who said that that was like a telltale sign that they had
Oh,
it.
oh,
But
interesting.
I felt sick with sugar the second pregnancy, and I didn't have GD supposedly with the second
Yeah.
pregnancy. So I don't know if that was a symptom. So
Yeah.
nothing really that was like, you have GD, this is it. So,
Right. So it's like it totally took me by
uh
surprise,
huh.
at least, because I was like, what? Like,
Were you
I
worried
don't
about
know.
that test? I was like
No,
worried,
no, I wasn't actually like,
really.
well, at least I mean, with my first, like, I didn't think I had any reason to be worried. Like, I don't
I
know.
I don't know why, but I was like really worried because I was like, I
Oh,
feel like I just had been eating a lot of sugar, so I felt like that
mm,
was a direct correlation, which
mm,
I don't think it is, but I remember just talking to my parents and I was like, I have my glucose test and I'm really scared and they're like, "Why are you scared? They're like you're not going to have it." I was like,
yeah, yeah.
I almost feel like I willed it into existence.
Yeah, and I guess I didn't really understand beforehand because I thought, yeah, like I'm healthy enough, like
Hmm.
I'm walking and like trying to exercise somewhat. I don't know, and I just like didn't think it would be me. And like sometimes there's no rhyme or reason to it, really. Like
Mm.
because they sometimes say it's genetic or whatever, but I learned, at least my doctor told me, like sometimes you just have it and there's not anything you can do about it, but I still felt guilty, like it was my
Yeah.
fault. There was like I did something wrong. Yeah, I wasn't eating right. I
Mhm.
Yeah.
Well, I think because you had gestational diabetes
Mm,
before me. And you had told me about it, so I knew that I could talk to you about it.
yeah.
And that helped. And you told me those things that, it could be random, and that your
Yeah.
doctor had said that helped, because I think on
That's
my
good.
end, that the doctor was more like, usually there's factors behind this, like that you
Right.
would, and it's not really random. And my end made it feel like my diet was completely the cause.
Seriously.
Yeah. And it was really hard. And they got me in talk. I talked to a nutritionist, which, I mean, honestly, I could have just done it on my own. Like, she didn't really help me at all. She was
Yeah.
nice. She was very nice, but she didn't do anything. And I got books and stuff, but it definitely made me feel like I had done
Caused
something.
it.
Like when he had called me on the phone and told me, I said, "Okay, so my husband and I are making this for dinner right now. Can I not have this?" And
Yeah.
he was basically like, more fruits and veggies and stuff like that. And I said, so I remember saying, well, fruits have sugar in
Sugar.
them though.
Yeah.
So I don't, how do I do that? And he goes, oh
Yeah.
yeah. So like no carbs, no sugar, like
Yeah.
no fruit. And he just basically told me no to everything. I was like, so you don't know what you're talking about. Like,
Yeah.
so that was hard, because I was like, you're my doctor, you're supposed to help, and you
Yeah.
obviously don't. He was a good doctor, but in that sense, it just made me feel like your diet needs to completely change and you are the
Yeah.
cause of this.
Yeah. And I like the first, I think like week after I found out, because it took me like a week before I had an appointment with like a dietitian or whoever.
Mhm.
I was like, I literally don't know what I can eat.
Mhm.
So I like hardly ate.
Yes.
And that's not good either.
No.
Like, but I was so scared, like,
Same.
I don't know what I'm supposed to eat. Like,
Mhm.
so I just wouldn't. And
Yep.
like,
I did that
that's
too. I did that
so,
same thing. And the other thing was, when I had talked to them, they had said to me like, "Well, yeah, you need a healthier diet, and you're pregnant and hormonal and have this huge thing that someone just dropped on you." So I'm
right.
like crying all the time about this, thinking that I'm
Yes.
like harming my child. And I just
Yes.
wanted to scream through the phone and be like, I don't know. I don't appreciate that you are just assuming that I have
Yeah.
a bad diet, because I'm out
Right.
here making myself like, I would make veggies and like sausages for dinner, and my husband and I were Dwayne and I were doing healthy meals that we were planning, like from
Yeah.
pregnancy books and things like that. And no, it wasn't like I didn't have the Taco Bell here or there or something that I
Right.
craved,
Right.
but I definitely wasn't living an unhealthy lifestyle or
Right.
eating foods that were bad for me. So
Right.
when they said things like that, it was just like, you're assuming
Yeah.
something
Yeah.
about me, and you don't know. And that hurt so much, just being like, how is it that the healthcare professionals are like not even helping me, and just like thinking that I'm
Yeah.
just eating junk food and that's what gave me
Yeah.
gestational
When that's
diabetes.
like not true
Yeah.
at all. Even the resources that
Mhm.
they provided weren't very helpful. The
Mm-mm.
most helpful thing for me was talking to other people who had gone through that. I didn't understand anything about it
No.
really. And yeah, I feel like people were assuming that like
Mhm.
I just knew like
Mhm.
what gestational diabetes was, what I should do to change.
Mhm. It's stressful.
It's so
I
stressful.
I rarely ate carbs for the last part of my pregnancy
Yeah.
because I was so scared. It would be like the smallest portion of carbs. And you helped me a lot. You'd send me pictures of like
Yeah.
foods that you made, which helped.
Yeah.
But like even that, I was like still scared to put carbs on
Yeah.
something. I would like have a massive heap like of protein because I wanted to
Yeah.
cancel out everything,
Right.
because it freaked me out. And
Right.
I just didn't want a spike because I didn't know what that was going to do to her.
Right.
I was so on my numbers that like I always wanted them to be on the lower side. And I
Yeah.
did have my dietitian told me, she's like, you can have it go higher. Those are low. And I'm like, okay,
Yeah.
still freaking out on my end because I'm like, I don't know,
Yeah.
like if it's closer to that, is it bad? I don't know.
Yeah. And you mentioned this when we were talking earlier about how you followed a few people on
Mm,
Instagram, which is
mhm.
not something that I thought to do,
Oh,
which I wish I would have, because I think that is helpful. There are Instagram profiles that
mhm.
have like more information
Or
about,
just moms too. Like, I would look for
yeah,
moms that were going
yeah,
through so I could see what
yes,
they, because there was sometimes it'd be like, "Come with me for, a day in the life of eating with gestational diabetes," and that would
yeah,
give me ideas to watch
ideas.
them, what they're eating,
Yes.
and then what their numbers were. And that doesn't mean that your number is gonna be the same because everybody is seriously so different when it comes to this,
Yes.
but it
Yeah.
did help me a little. Some
Yeah.
women would, like, take on a little bit more sugar than I was comfortable with, and they were totally fine, but
Mhm.
I was just freaked out to do it. But
Yeah,
it was
yeah,
helpful to see.
totally. I looked on Pinterest, just like
Mm,
gestational diabetes friendly
yeah,
meals, and that led me to like some blog posts
yeah,
about women who went through it and what they would eat. And but I still think it would have been helpful to know more of like the science behind it. I don't know if that
yeah,
makes sense. Like I didn't know that, like protein needed to be paired with carbs,
mhm.
or that fiber is really important in
I didn't know that.
slowing the absorption of glucose. So like fiber will
Interesting.
offset sugar as well. So like just knowing like how to pair foods,
Interesting.
and yeah, like what affects your glucose absorption, like exercise,
Yep.
like even at least I just found this out through trial and error when I was like taking my glucose levels,
Mm,
but even like a 5-minute walk
yeah,
around the block would just my
go
sugar
right
levels would
down.
just drop.
Mhm.
And so knowing that like I didn't have to do like an hour-long workout
Yeah,
necessarily to get my
sugars
levels
down.
down, like just
Yeah.
5 minutes of movement
See,
help. Anyways, just things like that, like I had
that's
no I
good to
just
know.
yeah, so I just feel like they need
Your
somehow
doctor needs to know more.
yeah, or like at least be able to have resources that are more helpful. Like I said, I
Yes.
did meet with a dietitian and it was somewhat helpful. What she told me was like the specific amount of grams of
Mhm.
carbs that I could have, which was helpful. And that's like all I really went off of.
Yeah.
But there was definitely more that
Yeah.
I
So
could
much
have.
more.
Yeah.
So much more.
Yeah.
And just the whole starting up of it too, like, honestly, I didn't know about, like, the monitor.
A
I
monitor.
didn't know
Yeah.
that that could go through insurance either. Like, I just bought my own.
Mm.
I
Oh,
should have had it.
really?
Yep, mhm, they didn't talk to me
They
about any
didn't
of it. No.
yeah, see, I feel like they just assume so
Mhm.
mu like that because they know, like, what they need to know,
Exactly.
right? And they just, like, relay the information, like, "You failed the test,
Mhm.
and here you go." But, like, there's a lot more that goes
Did
into
you
it.
did you have fear at all when you had to, like, do your first, like, little finger pricks, or were you just,
Oh,
like, fine?
oh, no, it was really hard for me,
Mhm,
actually.
mhm.
Like,
I
it was
hated it.
a learning curve,
Hated
and
it.
for the longest time, like, it was hard for me to get enough blood,
Oh.
and so I would have to prick myself multiple times,
Did your
and,
thing
like,
have settings on it?
it did, and I would try the
Ugh.
different I don't know, it just took me a while to, like, figure it out, like, it was just a learning curve for me, like, I'd never just, like, pricked myself before,
Oh.
and, like, and I that was another thing, like, I would just cry because I, like, pricked myself, like, 4 times, and I wasn't getting
Oh.
enough blood, or it would say, like, "Inconclusive
Mm,
reading," or
I
something, and I'm just
hated
like,
that. I
"I don't
hated
wanna
that.
prick myself again," like,
Oh.
and so it took me some time. So that's, I guess, something I would say to someone who gets diagnosed with gestational diabetes is, like, there really is a learning curve, like, give
So
yourself
much.
some time, and I felt that was another thing is I felt, like, a lot of pressure, like, I need to figure this out right
Yes.
now, and
Yes.
I need to, like, fix this like
Uh-huh.
right now. And I wish that I would have known that like I could take my time
Mhm.
kind of like learning the ropes, and like it's not going to hurt your baby,
Yeah.
like because but I felt that like pressure that like I need to figure this out right
Stressful.
now, and like
I think that's why I went out and bought my thing right away too, because I was like,
yeah,
nobody's helping me with this.
yeah,
But I do remember the first time that Dwayne did it for me to because I was
mm,
like, you do it because I was so scared. I hate needles, and he did it. And so I was changing out the little needle in it. I like pull it, and I learned right after that that it just like pulls too fast. And I was like, well, I didn't need to prick myself the first time because I stabbed myself with it as I pulled it out. There was blood everywhere.
ouch.
It hurt really bad. And so
No.
and so then the next day that I had to do it, he was not home and I had to do it on my own. And I remember just being so stressed out, just sitting on my
Yeah,
own, telling myself, you have to do this, you have to do this. And that was hard. It was just
yeah,
that was like a whole stressful. I hated it. By the end of my pregnancy, I had like little holy scab marks all over my
yeah.
fingers. And I don't know if this resonates with anybody else, but during pregnancy, I was still teaching. So I was teaching in my third grade
Mm,
classroom, and while you're teaching doesn't mean that that your GD takes a back seat to that.
right,
And
right.
so I still had to test, and that was tricky because you're in a classroom, that's blood, and I
Yeah,
was like, I had to go talk to my principal and I was like, hey, I can't not do this. So I don't know, like, do I need
right.
to send out? I ended up sending out a letter to parents and I had to like
Mm,
explain what was going on, which just
yeah,
the whole thing wasn't like I didn't want to have to be telling a bunch of like parents, like,
yeah,
hey, I'm pregnant and I have GD. Like, this is really fun. But it was
yeah.
like, I ended up having to tell them that was my situation. I was like, if this, is upsetting, please let me know, but I'm going to take a step out of the classroom and do it. Um,
Because you
and
have to
I
do it at
mean,
the same time,
you
like
do.
every day.
Uh-huh.
Yeah.
And so I I just the kids were very understanding and
Oh, good.
they knew what Miss Palmer was doing and
Yeah.
sometimes they'd come over and I'd be like, not right now.
Yeah.
And they knew what I was doing. And by the end of the year, because it was until pretty much the most, I left like a month early, but it was until the end of the school year for me. Like I ended up doing it at my desk, and I was just like, I'm not gonna step.
Yeah.
Like I don't
Yeah.
have the time. Like, but
Totally.
they were understanding for third graders. They did a
That's
great
good.
job, and it was but it was hard like when you're working and you like can't and you're with kids it's like I can't like just walk away from a bunch of 8 and 9 year old 9 and 10
Right.
9 and 10
Right.
year olds like you can't do that
Right.
so if
There's
anybody is
a
doing
lot
that
more that goes into it. And yeah, like it affects your daily life, especially if you're
everything.
working. Like,
Hmm.
yeah, like so much. And something that I didn't realize until I couldn't eat like carbs and sweets was what an emotional eater I am. And I was like so upset about like
Hmm.
having gestational diabetes, and all I wanted was to just down some
Oh
cookies
yeah.
or ice cream, and I couldn't. And I realized that like I did turn to food a lot for like comfort,
Hmm.
and I couldn't do that. And so I just had to like sit with my feelings, and that was hard too.
That's
So
interesting that you say that because that must have been me too, and I just didn't realize that
realize
feeling.
it. Yeah.
Yeah, because I had a whole Instagram saved file of foods that I
Oh yeah.
wanted. So like every time I was scrolling, I would be like save, 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 and it was like sweets mostly.
Yes.
I was just like, I want all of these things, and I can't have it. Did it lead like it led to like full on meltdowns for
Oh,
me all the
yes.
time.
Truly, it did.
Like
Yes.
I went to get food with Dwayne and I went it was just a very bad pregnancy day and I remember this it's like ingrained in my head and he didn't do anything wrong. He was just being a good husband. We went on a hike and I tripped and fell and he accidentally locked the keys in the car so by the time we got back to the car was locked and we had to wait for AAA and then we're they came and we left, and I'm hungry with GD, but I'm trying to be good. And we have a place here down here called Tender Greens. I don't know if you
Mhm.
guys have that. Do you guys have that?
No.
It's it's
I
super
don't
good.
think so.
But I knew that I
If we
could
do, I
eat
haven't been.
their one plate. And so I'm like, can we go get that? And so we go in, and he only ordered for me. And he was like, no, I don't want anything. It's okay. And I like the fattest meltdown. Well, I don't want to eat if you're not eating. And
Yeah.
he's like wanting to eat something else. And I'm like, I can't eat anything. And nobody,
Yeah.
I'm so hard to deal with because I just can't do
Yeah.
it. It's like
Totally.
the hardest thing. And he was like, I don't know how to help you. I
Yeah.
don't know what's
I
going
don't know
on.
how to handle this situation right now.
He's pointing at the food. I'm just like crying, like, this is the worst
No,
thing
I'm pretty
ever.
sure I had scenarios exactly like that.
Yeah.
So,
That day
mhm.
forever is just like burned into my memory. And he remembers it too. I mean, the worst. It was because we weren't supposed to go on the hike. I mean, I was wearing platform sandals, and we weren't supposed to be going on a hike. And then it ended with me crying about food because I have gestational diabetes. So
Yeah.
it was really great.
Oh,
It's
it
not
happens.
easy, and
It's not. And
it
I
can
would
happen
tell
to
my
anybody.
yeah. And I would tell myself like there's much worse things
Oh
that I
yeah.
could be dealing with. So
Yes.
I felt like I shouldn't be having a hard time
Hmm.
because I was like it could be way worse,
Yeah.
but it was still hard.
I mean, it's hard. It's the unknown, and it was both of our first pregnancies too, right?
Yeah.
And it just feels like your body is taking care of this baby, and so when
Yeah.
you're diagnosed with something, it's just like they can't. It's like they can't do anything. They're in there, and you do
Yeah.
feel like, what have I done wrong? I'm already hurt.
Yeah.
I'm hurting my baby, and they're just trying to grow and
Yeah.
live, and
You take that on.
you do, and then
Yeah.
you didn't do anything wrong. So,
Yeah.
like coming out of that situation, for anybody who's in that situation, you have done nothing wrong. Your placenta is
Yeah.
the way that it is, and
It's
that's
the hormones.
yeah, exactly.
Yeah.
It's the hormones, it's the placenta, the hormones of the placenta,
Yes.
and that's how your body is breaking down sugars or not or
Yeah.
whatever, and it's not you, and it's okay, and
Yeah.
your baby will be okay, and you and I both, we're diet controlled, but there's people out there who need insulin, and that's also
Yeah.
okay. And it's whatever you do to help yourself and your baby, and there's nothing wrong with it. Just
Yeah.
happens.
It's so true. And I feel like there's way more we could even
Oh
get
yeah.
into about that, but we'll probably wrap it up there unless
No,
you have
I was
something
just
to
gonna
add.
say. No, I was just gonna say. It makes you way more excited for that bite of like candy
Oh,
or chocolate after you're pregnant. So just be excited for that. Like have that be in your head. And just think like
that's so
how good
true.
it's gonna be.
It tastes way better
Oh, it
after.
tastes way better. You have so much more of an appreciation for
Yeah,
it.
that is so true.
Well, do you want to wrap it up? That was a great episode, and then we'll see everybody next week.